Hello, my name is Sarah, and I would like to talk to you today about immunizations and how important they are in keeping our children healthy. As a child, my mother made sure that I received all of my vaccinations so that I would not be at risk for disease. As of April 4th, the Center of Disease Control and Prevention has confirmed that the number of measles cases has grown to 465, which is up from 387 just the week prior. The total number of cases for 2019 is already on track to surpass the country's record, which was 667 in 2014 and 963 in 1994. This should be a wake-up call to all parents to have their children vaccinated, especially since measles was eliminated in 2000. The CDC defines eliminated as 12 months or more of the infection, no longer an epidemic. Measles is a very contagious disease caused by a virus. The disease can spread through the air from someone coughing or sneezing, and the virus can live in the air for 2 hours, meaning anyone that breathes in that air can be contracted with the virus. In 2015, the U.S. experienced a large multi-state measles outbreak linked to Disneyland, California. This outbreak likely started from a traveler who became infected overseas with the virus and visited the park while infectious. Measles still remain a common disease in many parts of the world, including Europe, Asia, and Africa. Measles will spread quickly when it reaches a community in the U.S. where groups of people are unvaccinated. If there were no measles vaccine, we'd have at least 4 million cases in the United States every year. According to Time magazine, 9,210 children in California contracted whooping cough in 2010, thanks in large part to unvaccinated population that helped it spread. A fully vaccinated 2-year-old child today can beat back 14 diseases. That is almost twice as many of a person like myself who was immunized in the 1980s. Children are vulnerable, and we as parents have to protect and ensure their safety. Do you use car seats for your kids?
Not anymore.
Not anymore? Well, do seatbelts?
Seatbelts.
Seatbelts. I think that we should view immunizations as seatbelts to keep our children safe. Vaccinations save lives. Over the years, vaccines have prevented countless cases of disease and saved millions of lives. Polio, which caused about 50,000 cases each year in the U.S., was a devastating childhood disease in the 20th century. But through successful vaccination programs around the world, polio cases it's been gone since 1988, and this reduction is the result of global effort to eradicate the disease by use of the polio vaccine. Vaccinations are a powerful tool to protect against diseases. The CDC website defines vaccines as a product that stimulates a person's immune system to produce immunity to a specific disease, protecting them from that disease. If children aren't vaccinated, they can spread disease to infants who haven't received all of their immunizations, or to people with weakened immune systems, such as transplant patients or patients with cancer. This could lead to long-term complications and even death to these vulnerable people. When you are vaccinated and you vaccinate your children, you are not only protecting yourself and family, but also protecting your community. If a large number of individuals are vaccinated in communities, you have what's called herd immunity. Herd immunity is a form of immunity that occurs when the vaccination of a significant portion of the population provides measure of protection for individuals who have not developed immunity. So we know all the benefits of vaccination, so why are people still choosing not to do it? Some people feel that diseases are no longer a threat because they don't hear about them anymore. Diseases in the United States are dramatically low, and because of vaccines, they have been avoided. But the U.S. has people visiting from all over the world, and it only takes one sick individual to come in contact with an unimmunized person to start the spread of disease here in the U.S. Some were led to believe there was a link between vaccinations and autism. This started 20 years ago with a British doctor named Andrew Wakefield, who wrote a research paper linking the MMR vaccine to autism. But no one was ever able to reproduce his findings. This accusation was declared fraudulent and later withdrawn. This study, although false, led to a decline in the vaccination rates, leading to a rise in measles and mumps in the US, UK, and Ireland, resulting in serious injury and death. Anti-vaccinators will also claim that they are poisons in the vaccines that we are administrating to our children. Why would a physician morally bound to ensure your health and safety, knowingly administer poison to you. Anti-vax claims they do not support Big Pharma. They do not support Big Pharma in their efforts to profit off of vaccinations, when in fact it is much cheaper to vaccinate than to get sick and be hospitalized. The 2008 measles outbreak had a cost of $10,376 per case, and the MMR vaccine is $20. There are risks with vaccinations, the most common, fever, soreness at the site, and occasionally a rash. There are risks with us driving daily in our cars, with the reported 6 million accidents a year in the United States, but we drive because it's a convenience. Sometimes the risk is outweighed by the benefits. To prevent diseases in our children far exceeds the risk associated with vaccines. Vaccines are thoroughly studied for 10 to 15 years and regulated by the FDA. Vaccines have spared millions of children from disease. We as parents need to protect our children. Vaccinations are not dangerous. The danger is not vaccinating children and them falling ill to what could have been prevented. Vaccines are a parent's civic duty, not only protecting our children, but our community. Thank you.